Hello and welcome back to my Fit Life Insight channel, your reliable source for all things health and wellness. Today, we're addressing a common but often overlooked issue: constant phlegm and mucus in the throat. Stay tuned as we delve into the causes and effects of this persistent condition. To begin with, it's important to understand what phlegm and mucus are. These are not just random body fluids, but important components of our immune system. Mucus, a clear and sticky substance, lines our nose, throat, sinuses, and lungs, acting as a protective blanket. It traps dust, bacteria, and other foreign particles, preventing them from getting into our lungs. Phlegm, on the other hand, is a type of mucus that is produced in the lungs and lower respiratory tract. It's usually thicker and may change color when you're sick. This is because it contains cells and chemicals that help fight off infection. However, under certain circumstances, our body may produce excess mucus or phlegm, which can lead to congestion or a phlegmy throat. This could be due to a range of factors, from a simple cold to more serious conditions. Now that we have a basic understanding of phlegm and mucus, we can move on to exploring the causes of their constant presence in the throat. There are several reasons why you might be dealing with constant phlegm and mucus in your throat. First off, allergies are a common culprit. When your body encounters something it's allergic to, it responds by releasing histamines. These chemicals cause swelling and inflammation in your nasal passages, prompting your body to produce more mucus as a defense mechanism. This can lead to a constant feeling of phlegm in your throat, particularly during allergy season. Next, let's talk about infections. Whether it's a cold, the flu, or a sinus infection, these illnesses cause your body to ramp up mucus production in an attempt to flush out the invading germs. As a result, you may find yourself dealing with a persistent phlegmy throat until the infection clears up. Certain foods can also contribute to mucus production. Dairy products, for instance, can thicken mucus and make it harder to clear from your throat. Spicy foods, on the other hand, can stimulate mucus production. So if you're constantly feeling like you need to clear your throat, you might want to take a look at your diet. Environmental factors also play a role. Dry air can cause your mucus to thicken and stick in your throat, while exposure to irritants like smoke or pollution can lead to increased mucus production. If you're constantly surrounded by these factors, it might be adding to your phlegm woes. Lastly, some chronic conditions such as asthma or gastroesophageal reflux disease, GERD, can lead to constant mucus in the throat. In these cases, the underlying condition needs to be managed to alleviate the symptom. So there you have it. Whether it's allergies or infections, certain foods or environmental factors, or even chronic conditions, there's a wide range of causes for that constant phlegm and mucus in your throat. But understanding these causes is the first step in finding relief. We have uncovered the causes, but what about the effects? Let's find out. Constant phlegm and mucus in the throat can be more than just annoying. It's a condition that can greatly affect your day-to-day life, sometimes in ways you may not even realize. One of the first and most noticeable effects of constant phlegm and mucus is difficulty swallowing. It might feel like there's always something stuck in your throat, leading to discomfort or even pain when swallowing food or drink. This can make meal times a chore rather than a pleasure, and potentially lead to nutritional deficiencies if it discourages you from eating a varied diet. Another common effect is a persistent cough. Your body instinctively tries to clear the throat by coughing, but this can become a vicious cycle as the irritation from coughing can lead to more phlegm production. Not only is it physically exhausting, but a constant cough can also be socially isolating, as it can make conversation difficult and may cause others to keep their distance, especially in these times of heightened health awareness. If left unchecked, the constant presence of phlegm and mucus can lead to complications. These may include throat infections, bronchitis, or even pneumonia, especially if the phlegm becomes infected with bacteria. While it can be discomforting, understanding these effects can help you take steps towards relief. Remember, it's not just about managing symptoms, but about seeking the root cause and addressing it. So don't hesitate to reach out to a healthcare professional if you're dealing with constant phlegm and mucus. In today's discussion, we've explored the causes and effects of constant phlegm and mucus in the throat. We began by understanding what phlegm and mucus are. These are substances produced by our bodies to protect and support our respiratory system. However, when produced excessively, they can cause discomfort and health issues. We then delved into the various factors contributing to constant phlegm and mucus. Environmental irritants such as smoke and dust, respiratory infections, allergies, and certain dietary habits can trigger an overproduction. Chronic conditions like asthma, gastroesophageal reflux disease, and sinusitis can also lead to this issue. Further, we examined the effects of constant phlegm and mucus. These effects range from mild discomfort and cough to serious complications like breathing difficulties and infections. It's crucial to seek medical help when these symptoms persist or worsen. We hope this discussion has given you a clearer understanding of the causes and effects of constant phlegm and mucus in the throat. Remember, your health is in your hands. Stay informed, keep an eye on your symptoms, and don't hesitate to seek professional help when needed. Thank you for joining us today on My Fit Life Insight. Don't forget to subscribe to our channel for more insightful videos on health and wellness.